So I'm Dr. Arzate, and I'm here in sunny Cancun, and I'm so happy to be here to have again Dr. John Minichetti.
Thank you for having me.
Thank you. It's an honor always to have big celebrities in implant dentistry like him. And I just want to tell you something. I took the Maxi course in Vegas, and then we started this here in my office, where we have been placed more than, well, it has been 4 years. Imagine, we have trained more than 40 doctors that they come from the States, Canada.
We're getting close to 1,000 implants.
1,000 implants, exactly. We have been crazy thing, obviously. And it's beautiful, but there's something that probably you're asking, which course do I need to take out there? Which one's better? Should I go to San Diego? Should I go to Chile? Should I go to Republican Dominicana Republic or whatever?
Right.
It has two things. One is the expertise of the Maxi course from the AID. That's a very important thing because you learn and be trained all the way from scratch. Like if you want to know implant dentistry, that's very important. Right. And the second one, it's like those live hands-on training programs. We have doctors that they are beginners.
Yes.
That they already took a year course, a year training, but they're beginners. Then you have intermediates, and then you have advanced.
Yes.
Can you tell me a little bit the difference between those three?
Yeah.
How do you train them?
Well, we have our different categories. Of course, those who have come with some experience, they have a background in either a preceptor course or a continuum course. So they would be at a different level. Many of the doctors are coming from our Las Vegas Maxi course. We've trained them on mannequins, pig jaws, cadavers, and now they're getting trained blunt life surgery. And so that's one of the doctors actually told me that. It's a continuum of learning, and it kind of puts all the pieces together. And then of course on those cases that we diagnose that are a little bit more complicated, we're going to give to those doctors with more experience. So they get the experience they want. They get the sinus slits, they get the ridge augmentation, and the other doctors can have a simple placement into a healed bridge.
Wow, that's good. So the feedback and the comments from doctors that have been trained obviously on the Maxi course, and you have also some things going on in your facility, another Maxi course, and the ones that have been coming here to my office here to be trained, what's the feedback that you have?
I mean, most of the feedback's been positive. Our reviews are always pretty good. You know, we send out our survey monkeys, and they're always pretty good. But it's what tells it is the word of mouth, because doctors are referring other doctors. We're getting growth in these type of courses, particularly our continuing education courses. We try to do it the right way. We try to make sure they have a science background before they come, so they get the most from the experience here. And I think that's really the proper thing with education, not just jumping the gun. And anybody can place a screw in a jaw, but to know how to do it and when and why, that's the key.
That's a learning curve that you need to know and that you need to be in implant dentistry. And we have a big celebrity here in our office. Thanks, John.
My pleasure.